The SyncTimes reporting solution is designed to provide relevant and accurate data on patient cycle times and care team productivity. The ultimate goal of these reports is to make it easier to 1. Improve patient satisfaction by decreasing wait times, overall leading to increased patient retention, and 2. Increased patient access by adjusting scheduling templates and adding additional visits without overloading providers and clinical staff. In this video, I will demonstrate how a health center might accomplish this through the SyncTimes reporting pages. Let's first start with patient satisfaction. It's no secret that a large portion of patient satisfaction not only comes from the quality of treatment they receive, but also from the overall experience of how they receive that treatment. To accomplish this, we focus on patient cycle times. Cycle times are comprised of a few key metrics. There's time in the waiting room and time in the exam room. Time in the exam room can be broken up into 3 different sections. Time spent with clinical staff, that's going to be clinical assistants and nurses. Then there's time spent with the provider, and there's time spent alone in the exam room. These 3 metrics are demonstrated here. Red representing alone time, green representing time with clinical staff, and blue representing time with a provider. Now this demo data here is comprised of 5 different health centers across different organizations across the country. And what we're seeing here are averages since January 2018. Understanding this information is the first step. Clinical staff often do not know how long their patients are waiting. For a nurse or a provider, the time is moving quickly because they are busy caring for multiple patients, but the time is crawling by for the patient in the exam room. Once clinical staff can see and understand this information, we can begin to set goals to improve the patient's experience in the health center. The most important piece to using this data to improve clinical workflows is sharing it, making it a part of every staff meeting. The data itself isn't going to change things. It is going to be the clinical assistants, nurses, and providers. Seeing this information frequently opens up opportunities to discuss what is working well and what isn't. Then you can apply these ideas to your workflows and watch the data to see what is helping. A couple best practices that we have seen developed over time with the health centers we work with are 1. Avoid rooming multiple patients at once. This inevitably leads to the patient waiting longer in the exam room. While this might get the patient out of the waiting room early, 9 times out of 10 the patient would prefer to be in the waiting room than in the exam room alone. It's much more comfortable, there's more to look at, and you're managing the patient's expectations. Second, we need to limit providers to 2 to 3 exam rooms at a time. We have gathered data from over 10,000 patient visits and have seen that as the number of exam rooms per provider increase, so does patient alone time and exam room utilization decreases. Not to mention, it is easier for clinical staff to manage 2 or 3 exam rooms at a time rather than 4 to 5. Let's go ahead and jump into one of these sites here and get a closer look at what their cycle times have looked like over time. Let's go ahead and select site number 23. This site is an excellent example of the best practices that were just mentioned. When we started working with this health center, they had patient alone times of 28 minutes. However, these alone times quickly decreased to 16 or 17 minutes alone in the exam room when the nurse manager was frequently sharing this information with her staff, but also working with her medical assistants to avoid rooming multiple patients at once, and also working with her providers and limiting them on the number of exam rooms that they used. As a result, we saw a pretty sharp decrease in patient alone time. However, after about 6 months, that patient alone time once again increased to 25 minutes. After seeing this, we got back in touch with the health center and learned that they got a new nurse manager who was not sharing this data with her staff and also had reintroduced the practice of rooming multiple patients at once. An important metric in patient satisfaction is the percent of time with clinical staff, which is what we're seeing here in this line graph. As clinical staff work to reduce patient alone time, this becomes a natural consequence that will follow. It is not uncommon when we start working with health centers to see percent of patient time with the care team below 50%. Patient satisfaction will increase as they spend a greater percentage of their time with clinical staff rather than waiting alone in the exam room. We also track some productivity metrics here in visits per provider hour. But for the sake of time, let's move over to the provider scheduling and exam room utilization report. Theoretically, if patient cycle times are shorter and patients are more satisfied, there will be more capacity in the schedule to see additional patients. This is why we have built the provider scheduling report. To explain this dashboard, it is best to go through an example. Let's say we want to increase visits at a department at site 28. We can filter by site and department here, In general, we can see that 8 a.m. and 4 p.m. are the slowest hours of the day, and 9 and 10 a.m. are typically the busiest. But let's drill down by provider, because oftentimes schedules can be quite different depending on the provider and also by the practice. So I'll go ahead and select a specific provider here and expand this view so that we could see each day of the week for this provider. Now I can see that on average this provider has capacity in the schedule to add an additional patient slot around the 8 o'clock, 11 o'clock, and 4 o'clock hours on most days, and Fridays in general are slower for this provider. So if I were looking for areas within this provider's schedule to double book or triple book to compensate for no-show rates or just a general slow hour of the day, I can look by provider by day for any given time period and make those adjustments to the schedule. This report can help take some of the guessing game out of the scheduling for your health center. A similar report is exam room utilization. We can use this report to identify areas in the health center where we could increase capacity. So let's go ahead and expand this once more so that we can see all of the exam rooms at this health center. And let's go ahead and select all the providers once again. This report can help answer questions like, where do we have space for a new provider? Or do we need to build more exam rooms? In general, exam rooms are underutilized, and this can often be improved by limiting providers to 2 to 3 exam rooms. So what we're seeing here is exam rooms 1 through 4 are pretty heavily used. Exam room 6 almost never used. Exam room 7 very lightly used. And in general, it looks like we're at around 50 to 60% utilization in all of these exam rooms. We'll go ahead and wrap it up here. These are some of the basics of the SyncTimes reporting solutions. There are a few other reports that we can go into, such as support staff productivity and patient surveys, but feel free to reach out to us to schedule a demo to dive into these reports or how SyncTimes can help improve clinical workflows while also collecting this valuable information at your health center.